Hello, I'm Dr. Len Saputo. I have with me today Dr. John Toth, who is the chairman of the board of the California Citizens for Health Freedom Organization. And I want to give you a little background about the organization before we get into introducing John. Frank Cuny is the founder, president, executive director who's been in charge of this organization for 20 years. It's a nonprofit political organization, and it's a 501c4. Dr. Toth has been with the organization for a number of years now and is really carrying a lot of the weight with Frank to make this organization support the people of California and also the doctors who want to practice in a way that's integrative. John, it's a great pleasure to have you here. Thank you for doing this.
Thank you, Len.
I'll tell you a little about Dr. Toth. He, as I said, is the chairman of the board of the organization. He's had extensive experience in both conventional and complementary alternative medicine. He's the past director of the ACCMA Academy of General Practitioners. He has his boards in family practice, and he was the previous chief of staff of Mount Diablo Hospital a few years ago. Quite an accomplishment for someone who's doing things that are integrative in an environment that's not always supporting that.
Thank you.
Yeah, so that's quite an achievement. Now, the mission of the organization, the California Citizens for Health Freedom, is to protect and expand the right of citizens to have access to complementary alternative medicine, natural treatments, and natural nutritional products, and live in a toxin-free environment. And that is really something that's taken a little doing, because we got a lot of big business out there that's trying to do something to stop us.
True.
And you've had an extensive background yourself in environmental medicine.
Yes, I have.
And you've taken that into clinical practice.
Yes.
For a number of years.
The last 25 years of my 50 years in practice was spent doing alternative medicine, basically environmental medicine, but anything else that worked.
Well, that's a good theory. If something works, it's worth trying, and bring it forward in an environment that's not always safe. Takes a lot of guts, John.
Thank you, Len.
I know I've had my own problems with that, too. There have been some goals that California Citizens for Health Freedom has, and one is to change the laws that physicians have had to face as far as restriction is concerned. And I know a few years ago you worked hard on SB 1691 and got it passed. What was that like for you?
Well, it was a lot of fun.
Okay.
It's really almost difficult to really categorize it into any particular way. It was just it was an adventure of trying to accomplish something that had to be done.
Yeah.
And I'm so happy that we were able to get it done. It's basically Frank Cuny's judgment and leadership that led us all to get this done. You know, doctors that have been practicing alternative medicine for years have been spiked by the medical board because they practice alternative medicine.
Right. Which is really cutting-edge medicine.
Absolutely. It is what a person will do when nothing else is working.
Exactly.
And if they're not doing that, they're not doing their job.
That's what I think,
My
too.
view.
Well, maybe that's why the law passed. It's because people finally recognize that just because something is different doesn't mean it isn't good. And if we've got limitations in what we can do, it's our obligation to be looking beyond the boundaries of where our training stopped.
That's exactly right.
So now we have that law behind us, and it's legal for doctors to be able to practice complementary and alternative medicine in the style that they want, so long as they inform their patients about that, not try to dissuade them from doing mainstream practices, and don't inflict any harm on the patients. That was the essence of that law.
That is exactly correct. That's what the informed consent is spelled out as.
Right. But we have another problem when it comes to treating cancer, because even though we have the protection of this law, doctors can practice treating cancer the way they want. There's also a public health law that makes it a felony in the state of California to do anything for cancer besides radiation, chemotherapy, and surgery. So now we're in another bind. Even though the medical board is looking past a lot of this these days, there is a liability of every doctor who tries to go beyond the boundaries of where mainstream medicine is if they're going to treat cancer.
That is correct. The medical board may not take any action, but other kind of legal action can be taken against the doctor by some other agency because of the public health law.
Right. So now California Citizens for Health Freedom is now engaged actively in trying to change that law. Tell us a bit about what's happening there.
Well, like I said, Frank Cuny is the heart and brains of this organization.
Well, he's not the only heart and brains. He's got a pretty good board, and you're leading it. So I want to congratulate you for that.
Well, we spend a lot of time on, usually Fridays, we'll get to the Capitol and spend some time talking with the legislators and their staffs and introducing them to what we're trying to do. And we're trying to get the law changed so that all safe and effective treatments of cancer are allowable by law in California. And there are a lot of other treatments that are available in other states and other countries.
Yeah, our California citizens have to move to other states or go out of the country to be able to get some of the treatments that they want.
That's exactly right.
And there's something wrong with that picture.
There certainly is. We're trying to get it changed, and I think that we're going to be successful with this. It's such a basic right, and it's so unfair not to have it.
Right.
That what we're trying to do is to just work our way through the legislature, get somebody to sponsor our bill and to support our bill.
And I know how hard you guys are working on that. And there's an event coming up, too, in L.A.
There is.
Tell us about the event.
That's an event held by the California Citizens for Health Freedom on a Friday night, September 2. I want to say the 2 instead of 2nd.
All right, so it's clear.
Okay, at about 6 o'clock at night at the Universal City Hotel in
L.A.
Sheraton Universal City is the name of the hotel in L.A. And
is it open to the public?
It's open to the public.
And what does it cost?
There's no expense involved. Just please come.
Great. So what we're looking for is exposure so people can understand what needs to be done to give doctors the right to practice the medicine that you want. And there are a lot of people engaged that are going to support this event.
Exactly right.
Well,
so they have to know more about it, though. And what we'd like to do is to let them know what's there and how we expect to go about this. We're inviting a lot of other people, and the members of the medical board and vetted especially, to this particular program so that they can understand what it is we're trying to do. And, of course, we've been in contact with them and working with them in a way that involves the medical board.
Yeah.
They're basically mostly in favor of us.
Well, I think that we've made some real progress, and my hat's off to California Citizens for Health, Frank Cuny, you, Dr. Toth, and to the rest of the board, because what we have here is a movement that's very much needed. We don't have freedom of choice in healthcare. There's no constitutional right that guarantees that. So we have to do our work in each state to make sure that we can do the things we want, and we shouldn't be sending our patients to other countries and out of state to be able to get the treatments that we have doctors here in California very qualified to treat. So I want to thank you one more time for being here.
Thank you, Len.
I look forward to seeing what happens in the meeting that's going to be in L.A. soon.
Should be a good show.
Should be a good show.
People will enjoy this meeting.
Thank you.